Really want to thank Migraine Ireland for inviting me to share with you some ideas that I have and really facilitate a discussion. I welcome this to be a very interactive presentation with discussion, questions, answers. You can talk to me in the chat if you're participating live while we're recording this today. And if you're watching this recorded later, hopefully what will happen is people in the chat may raise questions that you might have raised or may have ideas or suggestions that you might have thought about or maybe not thought about. So let me give a quick introduction to myself. I'm Dawn Buse. I am a licensed psychologist. I am affiliated with Albert Einstein College of Medicine in New York City, although I live in San Diego, California, and I am a clinical professor of neurology. So I've worked more than 2 decades with people with migraine, other severe headache diseases, other chronic illnesses, trying to help people really live the best lives possible, get the best treatment possible, and take care of themselves as much as possible. I realize some people watching may be people with migraine. Some people may be caregivers or family members or loved ones of people with migraine, or you may be both. Since migraine tends to run in families, you may be both. Or you may have another type of headache disease, and hopefully, a lot of what we talk about will be helpful. I'm going to share my disclosures because we always share our disclosures. I do a lot of scientific work. I do a lot of publications, a lot of research studies, and here are the companies that have sponsored the various research projects I've been involved in and that I'm a consultant with. So that's important to share that. I may be talking a little bit about some data from some of these studies, maybe the Cameo study, the Chronic Migraine Epidemiology and Outcome study, or the Overcome study. And if you didn't see it, I actually gave a presentation with Migraine Ireland called Life with Migraine previously, which is also recorded, that you might find interesting as a companion to this presentation, kind of about navigating all aspects of life with migraine, be it career, education, marriage, parenting. I reviewed some of the data that we have in the world about the disability associated with migraine from the Global Burden of Disease study and US, European, and international studies as well. Unfortunately, we don't have any Ireland specific data. I wish we did, and that's something we should really think about in the future. But you may want to go back and listen to this presentation as well if you find this helpful and want to fill in some more of the gaps. So you probably know this answer as to what is migraine, but a very quick reminder and overview. Migraine is a chronic illness. We tend to say someone has migraine. It may first manifest with a migraine attack or severe headaches with other symptoms that come on often during adolescence or young adulthood and may last for several decades of one's life. I'm guessing if you have migraine, looking at this big white circle might be a little painful. And so I'm going to switch to the next slide. I'm sorry about that one. Um, and as you know, a migraine attack can have many symptoms and be many phases. And a migraine attack can last many days, actually, when we think of all the phases. So a migraine attack may start with the premonitory, pre-headache phase, and that may be a whole 24 hours where you just kind of don't feel like yourself. And you may have some other odd symptoms like excessive yawning or fatigue, neck pain. That's one that I feel before migraine. That's a common one. That photophobia, which is extra sensitive to light, extra sensitive to sounds, is phonophobia, and osmophobia, extra sensitive to smells. We're going to talk about how all those relate to holiday celebrations in just a moment. And then some people will have an aura, and an aura can last between 5 and 60 minutes before or at the beginning of the headache. And it can include interesting from a scientific perspective, burdensome, uncomfortable, scary from a human perspective of someone experiencing them, symptoms that have to do with your senses. They may be visual, it may be lights, that could be sparkling, shimmering. You may have kind of waves. You may lose a whole part of your field of vision. You could have tingling or numbness on one side of your body. You could actually have hallucinations about smells, things you don't that aren't there that you think you smell. You can lose the ability to talk, which is very scary. Difficulty to form words. So all sorts of senses, your sights, your smells, the sounds, and kind of the physical sense of your body. Those symptoms should resolve within that hour. And then people go on to the headache phase, which is not just headache, it's a whole cornucopia, to use our holiday theme. We just had Thanksgiving here in the United States. So a whole cornucopia, a whole buffet of symptoms. Headache, which may be on one side, it may be pounding and throbbing. It may get worse with physical activity like climbing upstairs, but you also may have the nausea, which is a whole other layer of discomfort. You may or not vomit with the nausea. Some people throw up and get sick. Sometimes people say it makes them feel a little better after it's over. Sometimes it doesn't make a difference. And that sensitivity to light or sound. So those are some of the symptoms of the headache phase. And then even after that's over, you may have a postdrome, which could be another 24 or 48 hours of really not feeling like yourself. Some people will call this a migraine hangover. You may have cognitive symptoms. It's hard to think clearly, hard to make decisions, hard to feel like you're really at your sharpest. Those cognitive symptoms actually may go through all the phases, but a lot of people feel them in the postdrome. You may have fatigue, you may feel depressed, you may just really need time to sleep and rest. You may have allodynia at any of the phases. That's when something hurts on your skin or hair that doesn't usually hurt, like wearing your hair in a ponytail or a headband, shaving, wearing glasses. That's called cutaneous, meaning skin, allodynia, meaning dynia, pain of something that usually isn't painful. That can also go through all the phases. And then even the interictal. We borrowed this word from epilepsy. In epilepsy, people use the word ictal. Doctors and scientists use the word ictal for during the attack, and then interictal between attacks. So we borrowed this word for migraine. Ictal meaning during the attacks, and then interictal meaning between attacks. A lot of people between attacks still have some lingering symptoms. Like some people may always be sensitive to light, may kind of always have the sunglasses with them or the hat with them, may avoid being out in the bright light of the daylight in the summertime, or overhead fluorescent lights, or bright lights of the movie theater or a discotheque, wherever it is. That may be continuous. Some people interictally may have the cognitive impairment, just not feel like themselves. Memory, attention, focus just may not be as sharp and clear as they would like to be, as they feel like they should be. And that cutaneous allodynia may always hurt to wear a ponytail, your hair in a ponytail, or the headband or the tight hat. So I wanted to keep this in mind, just that quick overview of what is migraine. Migraine is a chronic disease. It affects about 1 billion people on the planet, about 12% of adults, about 18% of women. So about 1 in 4 households usually will have someone with migraine. Although we tend to see it run in families, there's a genetic predisposition. So it might be a cluster kind of in a family. I talk about why that can be hard at the holiday time. And it is, according to the World Health Organization, the global burden of disease, they've acknowledged it's the second most disabling disease on the planet when you account for all of the lost time at work, school, family, social, leisure activities. So all of this is going to relate very much to enjoying and participating in holidays. As I said, the World Health Organization has indeed confirmed in their most recent analysis that migraine is the second most disabling disease for men and women combined of all ages. But when we look at people aged 15 to 49, actually women aged 15 to 49 is the first most disabling disease because it's so common. And when we think about disabling meaning you're not able to do things you need or want to do. So, of course, when we just talk about this whole smorgasbord, this whole buffet of symptoms, any of them alone could be disabling. Feeling nauseous, um, not being able to be out in the bright light, pain, let alone when you put all these together and you think about that this whole thing, an attack, may actually take a couple days when you go from prodrome, maybe aura. Aura happens for about 20% of people. Headache phase, post-drome, recovery, that's a long time. Of course, it's going to impact work, school, family activities, social activities, friends, dating, hobbies, volunteering, church, personal time, your identity. There's a high rate of stigma associated with living with migraine. People with migraine often feel quite guilty about it. They worry about letting others down, not doing enough, not being there, missing out. And of course, all of this is wrapped up in the holidays. So, as I talked about just a moment ago, a study called My Migraine Voice, which was published in 2018, asked people around the world, how do you feel about migraine? And people say they feel misunderstood, they feel depressed living with migraine. Some 39% of people said, I hate my life. 39% said, I feel helpless, I have no control. I wanted to share these data so in case you also have these feelings, you know that you're not alone. And I don't want you to be embarrassed or feel guilty about your feelings of feeling guilty, frustrated, depressed, worried. These are entirely normal human or any organism beyond humans. These are entirely normal responses to living with a chronic, painful, debilitating, unpredictable, often relentless disease. So, okay, now I've kind of been the Grinch here and I've told you a lot of tough stuff, but let's really think about how we are going to get through the holidays, remembering that you have a right to your feelings, but also thinking about how we're going to navigate and try to carve out time for you. Try to think about what is important to you, what you might enjoy, what might bring you happiness, comfort, um, what you really feel that you want or need to do for your family, and kind of how to get through that. So, let me look at the chat very quickly, see if we've got anything coming up yet. I see everyone who has joined. Hi, everybody. And we don't have any comments yet. You are entirely welcome to write comments and questions as you go. If you just want to say, heck yeah, I agree, or uh, I have a different experience, just feel free. Thumbs up, thumbs down, questions, ideas, whatever you want to put in the chat, feel free. So, okay, let's talk about the holidays. The holidays, right now, if you're watching live, we are in the winter holidays, which include actually a whole set of holidays, about 2 or 3 months of holidays. We may have viewers right now from different, in addition to Ireland, different countries. We may have viewers from different who practice different religions and so have different sets of holidays. And I know in the introduction to this presentation, quite a few different types of holidays were listed. I'm really glad. And so it's not always one type of religious holiday. The world is becoming smaller and smaller, and people may be celebrating, even within the same family, multiple types of holidays. But let's talk about holidays in general. Holidays in general are a tough time emotionally. And I think that that might be fueled by the fact that we actually have these expectations of these idyllic holiday experiences. They come in movies and books and stories and childhood hopes and dreams and memories. And for many, many, many people, holidays bring up a lot of stress, worries. Not everyone had a safe or happy childhood. Not everyone is having a safe, happy, healthy adulthood for so many reasons. And so we can't assume that they are as idyllic as traditional media or social media might show us to be. We have to think about challenges that come up this time. This is the time of year when we often have this idea that we should get together with family, be it our family of origin, be it our current family. And people may be dealing with grief or loss, be it death, be it divorce, be it separation, for any types of reasons. Maybe there might be loneliness about not having a family or the family you wanted, about maybe not having a partner or the children, or that there's stress in those relationships, maybe not having the same friend group for whatever reason, or romantic relationships. So, relationships are a bit of a hot topic any time of year. And when you put these expectations that this is going to be this ideal, wonderful, cozy time for families, there's a lot of pressure there. There are a lot of health concerns that anyone may have at any time, be it migraine or other things. Knowing that migraine is comorbid or co-occurs with a whole range of diseases and conditions, chances are, if you live with migraine, you are also probably managing some other health conditions or diseases, or you may be taking care of family members, friends, others who have other serious or chronic health conditions or diseases, which make enjoyment, participation in holidays difficult. Finances may be difficult. Holidays can be expensive in so many ways, that the ideas of gifts, of hosting, of purchasing, preparing, bringing food and meals and clothing and shopping and decorating all adds up. And many people with migraine are not working, or working less than they would like to be, or working in a job that maybe is not the job that they would hope that they could have if they did not have migraine. So finances are affected in any case, and the holidays are just expensive in any case, because we have a lot of expectations that, again, society and the media puts on everyone. And let's talk about expectations. I think people with migraine can be very hard on themselves. We can often be our worst critic, but we expect a lot. And sometimes the body just is not going to allow you to participate at the level that you would expect you should, or hope you should. And part of what I really want to talk about today is that's okay. I really think that it would help the whole world if we would all kind of shift our expectations, and um, bring down some of the real expectations, and maybe in media and social media continue to show a little bit more of the realities of the hardships. There's also a lot of social and political unrest today, this week, this month, this year, in Ireland, in the US, in Europe, in the Middle East, around the world. This also may be a time that it feels odd to celebrate while there is a lot of distress, suffering, danger, and many people are in dangerous or stressful or situations where they don't have their needs met and can't really celebrate in the same way. So, a lot to think about. And chances are, of the people listening, I may have not even mentioned what is closest to your heart right now. With all these ideas I suggest about why holidays are hard, I may have not even gotten to your particular exact issue. And let me look at the chat for a minute. Oh, this is a good one. So Jillian says the sleep that's often needed is not always accessible, especially if you're not at home. But can sleep under a roller coaster and have. How can this be resolved? Okay, Jillian, that is really a good question. I'm going to come back to that. I have that coming up. Yes, we're going to talk about healthy schedules and how they get completely thrown off during the holidays. So, Jillian kicked us off. Would anyone like to put in the chat what comes to mind? What are some of the more challenging aspects of the holidays for you? I realize this might be too personal of a topic. So if you want to log in as anonymous, that's fine. Or if you'd like to keep your comment more vague, that is absolutely okay. Or if you just want to kind of keep it in your head as we talk, that is absolutely okay as well. But let's think about, do we have any comments yet? Okay, Jillian says, thanks. And all right, okay. So there are so many aspects that can be challenging, as I just mentioned. And Jillian kicked us off with one of our big triggers. So, are there particular triggers that come up for you more often at the holidays than other times? I bet there are. So we know that the migraine brain and nervous system can get kind of thrown out of whack with changes in sleep schedule, um, not eating on a regular basis, not being hydrated, changes in stress. And really interesting, our research shows that both increases in stress and decreases in stress can set someone up for a migraine attack. And you think, what is going on there? Well, there might be a change in the corticosteroids or the stress hormones that are higher during a stressful period. And when they drop, that change might be a problem for someone. And that's why we might see things like weekend headaches, Saturday migraines, vacation migraine, and maybe holiday migraine. Same thing with sleep. Too little or too much, or just changing your sleep and wake time. It's going to happen if you travel. It's going to happen with social events. That can happen with air travel where you go to a completely different time zone. Um, if you are on a schedule where you eat at certain periods, certain times of the day, that can certainly change. You may not be at work, you may not be at your own home, you may be traveling, as Jillian said. How do we kind of keep some normalcy and routine? And how do we keep doing these healthy things, which are so helpful and protective, while we've got these very mixed up schedules and things kind of in an unusual non-routine time of year. You may be exposed to some of the foods, drinks that may be more of a trigger for you. Changes in stress up and down. There may be a lot of sensory issues, be it lights, noise, or scents. For example, there might be a scent if you have a Christmas tree of a pine scent that might be strong. There might be scents of candles. People burn candles a lot, scented candles at this time of year. I don't know how many people can walk by a candle store at the out at the shops or a candle stand and notice even from quite a distance the strong scents and odors, and that can be really uncomfortable for some people. And I mentioned travel, time zone changes, environmental changes, schedule changes. People with migraine may get motion sick, which could be car sickness, air travel sickness. Um, so a lot of potential triggers out there having to do with the fact that our schedule and routine is really thrown off for holidays, be it a couple days, be it a weekend, be it a whole week of vacation or travel, and that can be really hard for people. So as much as possible, um, let's see, uh, the smell of certain candles in shops makes the floor feel like it's moving for me. Yes, Deidre's waving to me. Absolutely. Uh-huh. Yes, exactly. People will mention that with the aromas from the candles really being triggering and uncomfortable for people. And when you get a whole bunch of them together in a store, boy, that's a lot. So, okay, we can sit here and say, I need to keep a routine. Great. But in the midst of all that, you have maybe family or friends or vacation plans, holiday plans that are not on routine. And that can be where this gets really hard for people. Explaining to other people what you need, kind of negotiating and setting those boundaries for yourself can be really challenging, especially when we're back with our family of origin, our parents, our siblings, our extended family who may want to tell us what to do. And during the year when we're not with them, we're kind of able to plan our own schedule or routine. Or we may have parent guilt where we want to make the holidays special and magical for our children or other family members or even our pets. And we kind of go out of our way for other people. And in the end, it may be really a struggle. And that struggle may lead to more migraine attacks or just may be really not feeling well. So let's flip this and talk about what have you found to be helpful during the holidays? Do you have any strategies you've used in the past, ideas you'd like to try this year, anything you want to put into the chat? I found this cute Christmas tree post on social media, and I liked some of these ideas. Self-care at Christmas, but it can really apply to any holiday, any time of the year. It's okay to pause. You're allowed to say no. We're going to go into that a little bit because that can really be hard for people who want to make sure, kind of please everybody else and keep the season magical for everybody else. Your best is totally enough. We tend to feel a lot of guilt about the effect of migraine on others. Are you not participating? Are you coming late to an event or leaving earlier? Or can you not participate in a certain event? There's a lot of guilt associated with that. And that's something that I really want to talk through today to really empower you, give you permission to set the boundaries and the expectations that you need, because ultimately you will have a better experience and ultimately the other people around you will as well. And there's no such thing as perfect. And this is certainly true this time of year. We can run ourselves ragged trying to create idyllic holidays that seem perfect, cooking, cleaning, shopping, whatever it is. And yet, I don't know that there's a perfect. And the idea of modifying, adjusting your expectations to what works for you, no matter how big or how small, really is your perfect. So we got some comments. How to ask people not to wear strong odors without being rude. House guests. People using seatbelt in my car can leave me feeling nauseous till the smell dissipates and could take weeks. It's hard to always need allowances because they seem so picky. Jillian, this is a really great comment. Not asking people to not use scents, perfumes, colognes, is a really tricky one because it feels like to some people that it's a little personal. Asking someone to not light a candle that has scent may feel a little less personal, although in their own home, they also may feel like it's their home. They have the right to do what they want. So when you talk about things like those kinds of requests, it's important to use I language. Explain, I live with migraine. And while this may sound surprising, the scent, the molecules from the scent actually can affect my nervous system, making me nauseous and also making it more likely for me to have a migraine attack, which can be multiple days of really debilitating symptoms where I'm going to be out and I'm going to be in bed and I'm going to be trying to recover. So, starting with the I language, doing a little bit of education if the person doesn't know. There's a chance the person does know. Perhaps it is a friend, family member, or colleague who does know. And you really are doing more of kind of trying to get them to have a little more empathy. But saying these things before they happen as much as possible is helpful. It can help avoid some of the embarrassment, some of the problems. It may be as much as, say, you were hosting an event at your house, maybe on the Evite or your invitation that you send out, you might actually say, please do not wear scents. And you say something like, I want to be able to host and the scents are triggering for my migraine symptoms. If you say it in advance, that might give people an awareness in advance and help them think about it, start to spread more awareness. And really, you're advocating for everybody. You're going to help everyone with migraine and other sensitivities to not be surrounded by scents. A lot of workplaces have gone to having that policy, or at least mentioning that policy, some of the larger workplaces. I'm curious if your workplace has a policy about scents or if it's ever been mentioned. But this is a hard one to advocate, but it really, really can help you. So I think mentioning it in advance, try not to single out anyone, and kind of just make this consistent. And I wonder, what if this may sound kind of funny, like kind of like you're an Uber driver, a taxi driver, but what if in your car, well, but the thing is people wouldn't put on a scent once they were in your car after they got in your car, but maybe they think about the next time. So what if in the car or at your desk at work or in your house, there's a little sign that says, please do not use perfumes, colognes, or scents as it triggers, we could say migraine symptoms or neurologic symptoms, something like that. And you start kind of making this more something that you just say. So people start to kind of get used to this idea. And believe me, you're not the only person. There will be many people that benefit from bringing this awareness of discomfort of sense. What else? I have ocular migraine. I'm wondering, would the artificial light make migraine more often at this time of year? I find migraine less often severe in summer months. LED lights are especially not suited to anyone living with migraine. Um, that's a really good point. It's not only, as you mentioned, the type of lights, LED, fluorescent lights can be harsh, but also the tone of the color. Dr. Rami Burstein at Harvard has found that there's a soothing green tone, which is very comfortable. And he's actually created a lamp in conjunction with a company with a soothing green tone that's more comfortable. The red and blue tones can be more painful, as the brighter light can also be more painful. And then, of course, the blinking. So, for example, if you happen to be at someone's home and they have a Christmas tree or another type of celebration with a lot of lights, Diwali with a lot of lights, a Hanukkah celebration with lights, any type of celebration with lights, if they were able to set the lights to a steady tone rather than blinking, that could be helpful. In addition, contrast is particularly painful for people with migraine. So bands of light and dark can be painful. Having more soothing kind of subtle transitions from light to dark is also helpful. So these are some subtleties that you can think about in your own home. You may be able to turn the lights down low, keep them steady, not blinking, and even think about bringing in more green, more soothing green. Um, to actually start to combat some of that. And then also think about if there are holiday lights, especially if they're blinking, if you turn on ambient lights around you, you will not have as much contrast between the bright blinking lights and the rest of the room being dark. So try to kind of even out the light tones. And I'm wondering if that's why Elle said that summer's a little better, because everything's kind of more of a brighter light, but you don't have as much changing unless you go from indoor in a very dark place to outdoor in a bright place. But in winter, where you have a lot of darkness, you'll go from darker days outside, darker nights, to a bright lit indoor space. And that contrast and that change can be painful. So here's a couple of suggestions to think about that you may already thought about for kind of holiday survival. So one is have your travel pharmacy and comfort kit that goes with you. Put it in a bag and take it with you. What can that comfort kit be? It can be anything if you are out and about and hit with a migraine. It may be medication, it may be earplugs, an eye mask, a small, comfortable neck pillow, or a hot or cold pack. It could be a small blanket. Anything. It could be a mask that filters some of the smells or scents. Anything that you find comfortable, bring with you. Do not leave home without. And of course, all of your treatments as well. Also, that comes to a point that I'm going to make 2 points down. Let me jump down to that. Communicate your needs clearly in advance, and please don't feel embarrassed, guilty, shy to ask for what you need. Migraine is a medical condition. It is a disability when an attack hits, and you have every right to ask for accommodations that will make you more comfortable and more healthy and not have the high risk for an attack. So that might be something like if you know you're going to an event with friends or family, you say something in advance like, if I have a migraine attack during the event, is there a place that I could sit or rest that could be a little quiet away from people for a bit of time where I can take my medication? You set that plan in advance. You may or may not ever need to act on it, but you've told the host or hostess this could happen. You also explain in advance when you accept an invitation. If I have a migraine attack, there's a chance that I may need to come late, leave early, or may not be able to make it. Is that okay? And there may be cases where someone is hosting an event that really has a certain number of people. And maybe that really is a problem. But most of the time, most people will probably be able to be a little bit flexible, understanding if you say in advance, I may have to come late, I may need to leave early, I may need to sit out, sit somewhere dark and quiet, take care of myself, or I may not be able to make it if a migraine attack occurs. The reality of that is there's some people who will not be so flexible, who will not be so nice about it. And I'm guessing you've all encountered some of them in your lifetime. But there's a lot of people who will hear that, they'll know in advance. And if it happens, it's not as difficult to ask for that help. And really, there's a lot of people who want to help. They just don't know how or what to do. So, giving them some of these requests actually gives them a way that they can help, and that makes people feel good. So, point two, scale things back. I feel that the holidays, all the holidays and expectations have gotten so big and so grand between traditional media like movies and TV and social media. But think about whatever holidays you're celebrating, what is the meaning and what is the essence that matters most to you? Is there some aspects that you really care about? And can you really focus on that smaller aspect and tone down the whether it's the length of time, the amount of money spent, the distance of travel, the amount of preparation? Can you tone some of those things down and really think about what it is that brings you happiness, joy, peace, comfort? And you may have one or two people you're also really thinking about. Maybe you're really thinking about your children or your partner or a senior member of your family. Um, you may want to think about what would bring you and that person or those people the greatest comfort or peace or enjoyment without trying to please everybody around you. So let me look at the chat a little bit. So Jillian said, about perfumes, there's no policy, but I can, because I said, do you have policies in your workplace about scents? She said, but modern ones are especially overpowering that younger people like to wear. So I really think that the scent is something that we all need to continue to advocate for. And perhaps you could find information from Migraine Ireland or the International Headache Society or the American Headache Society, American Migraine Foundation that you could take to the workplace and explain that scent is something that is very uncomfortable due to heightened sensitivity during and between attacks and potentially a trigger, and that it's very important for people to not wear strong scents. This is kind of a battle that I think people with migraine have been fighting for a while with mixed levels of success, and sometimes people do not respond well and do get offended. But the more that we all continue to share this information, the better off we all are. So going down to number 4, as much as possible during the holidays, we need to keep the healthy routines, which really don't go well with the holidays. Trying to get enough sleep, trying to go to sleep and wake up at the same time every night, trying to get in some exercise, trying to eat some healthy meals and eat on a regular schedule, staying hydrated with good hydrating drinks, water and others, and avoiding excess of alcohol, excess of caffeine, excess of the energy drinks with the energy containing combinations. As much as possible, these things are really comforting, soothing, healthy, protective for the nervous system for anybody and are very helpful for people with migraine. So we can know that, but then we get back to, okay, how do we integrate that with family, friends, travel, social events, work expectations? That's where it becomes a little tough. And that's where you might have to get a little creative. How can you maybe moderate the number of alcoholics or caffeinated drinks with switching in and out water or fruit juice? How can you think about maybe getting enough sleep by letting someone know in advance that you will need to leave the event at this time, or that how can you squeeze in some exercise during these holiday periods? Those can all be challenging. Exercise, maybe it's not your usual routine, but maybe you ask everyone at the event you're with who wants to go take a walk after the meal. There might be ways to start to think about getting in some exercise, some movement. I also talked about asking for and accepting help. This can be really hard. There's a lot of stigma with migraine, and people may feel embarrassed to ask for help. Um, but people want to help, and it actually gives a lot of people a way that they can actually help when you give them something specific. So if people say, "Is there anything I can do for you?" It's tempting to just say, "Oh, no, thanks. I'm grand." But this is the right time to say, "Yes, in fact," and be prepared with something. And this may be a place where your host says, "Is there anything you can do for you?" You say, "In fact, if you could ask people not to wear strong perfumes, that would be really helpful." Or, "Yes, in fact, if there's a place that I could go sit in kind of a quiet place if an attack comes on, that would be great." Be prepared with your ask because that will give them something they can do. And then, as I was talking about, this is really the time to reassess our expectations, to maybe lower or bring them into what really matters the most, and really accept where you are. With everything going on in the world right now, you may not feel like celebrating the holidays in the same way. With what's going on in your own personal life or health, you might be in a, or finances, wherever you are, you might be in a different place. It doesn't have to be forever, but it's where you are now. And accept where you are now and know that that's okay. And try as much as possible to kind of protect yourself the way that you would really care for someone else going through something. So let's see, we've got another question. Um, so Elle is talking about light and said, "Thank you so much. One last quick question. Are daylight bulbs been helpful to anyone with migraines? Thank you for your advice." Okay, so there are, as Elle is mentioning, there are bulbs that can be used that are, as you know, all the light bulbs now come in different tones from warmer to cooler. And you might find that there is a warm to coolness that is more comfortable for you, as well as the bright to dim. And for a lot of people, the little bit warmer seems to be a little bit more comfortable than that cooler. The warmer is more yellow, the cooler is more white and blue. So the warmer seems to be a little bit more comfortable. And Elle, I'm wondering if you're also talking about phototherapy, the daylight therapy that can be used to set your circadian rhythm, help you fall asleep and stay asleep on a regular circadian rhythm, and can be used therapeutically to treat seasonal affective disorder or depression. Um, that can be helpful, especially for Ireland and other countries that may be quite dark during the winter, to treat circadian rhythm, keep people on a good sleep-wake cycle, as well as treat mood and depression. Um, and the way that the phototherapy is delivered is quite specific in the timing. It's quite specific in the light. It's generally 10,000 lux of light. It's quite bright. Um, and it needs to be in the upper part of the visual field. It needs to be the right time of day. So often that's the morning. We don't want to stimulate people at the evening when they're ready to go to sleep. Um, but with migraine, you might find that that amount of light is painful. You don't need to look directly at it. It needs to be in your visual field, but you don't need to look directly at it. A couple things that might be helpful is making sure there's enough light on around in the rest of the room if you are to try phototherapy, so you don't have a stark contrast between the phototherapy light and then the rest of the room being dark. That can be helpful. You don't have to look straight at it. It can be kind of off in your visual field, and you might be doing something down here a little lower, watching television or reading a book a little bit lower, and it can be up here so you're not staring straight at it. And you might start with shorter periods of time and kind of work your way up to the therapeutic dose. So certainly you know your body best. If something is painful or triggering, that is not going to be a good match for you, but there's some things that might be helpful. So I talked a little bit about expectations and adjusting your expectations. And let's see what time it is. Okay, we've got about 15 minutes left. So adjusting your expectations. So this is actually a formula that's come from scientific work on happiness, scientific research. And so it's really interesting that happiness or contentment or satisfaction is what is the reality, what happened, what was the outcome, over the denominator of what are your expectations. So you can make your reality better, 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 and something we'd all like to do. Um, being happier, being more wealthy, being more healthy, being having more friends or more material things, whatever that reality is, as well as we can change our expectations. And a lot of times it's actually much easier to change our expectations. That's much more in our control than changing the reality. We're probably all doing what we can to change our reality for the better, but changing the expectations is something we can always do. So I don't want to say lower your expectations, but I do want to say bring your expectations in. And when it comes to holidays, really starting out the holiday season with a reasonable set of expectations that can be fulfilled, focusing on what's really the core of what makes you happy, what makes you or the loved ones who you really care about happy, brings you joy, peace, contentment. And staying focused on that core is really valuable to being happy, satisfied, and content with anything, including the holidays. We talked a little bit about having the backup plan, talking to your host or friends, or if you're the host, talking to people coming to your home or your event about that you may need to come late, leave early, you may need to go into a dark room and take a medication or rest or even sleep. All those can be helpful things. It is so much easier to talk about this in advance and not even have to use it in many cases, but it's there. It brings you comfort. It might help with some anxiety that you're having about social events or an event coming up, or anxiety you have about making plans. That is so common in research that we measure it in research and we measure it in the clinic, and we've given it a name, pre-ictal anxiety or interictal anxiety. And we find that people with migraine will avoid making plans altogether just so they don't have to cancel or let someone down or come late or leave early. But that's not good for your quality of life. There may be cases where you say, I really don't want to go to that event, and that is absolutely fine. Um, but there may be things that you want to go to if you're feeling up for it that day for the amount of time that you want to be there. And so we don't want to cancel or avoid making plans or commitments to everything in life. Try to have these backup plans, have your friends, family, hosts, colleagues understand your needs so you can still participate to some extent and still get some joy out of it and not feel like you're missing out entirely. Um, looking to see if there's any new questions that have come through. Not yet. I think that it's really important for us to think about accepting that which we cannot change. And John Kabat-Zinn, who's a psychologist who really pioneered mindfulness for low back pain, said, we can't stop the waves from coming, but we can learn how to surf. And that's really what we're doing in this conversation today, is coming up with strategies and ideas and ways to kind of navigate when that wave comes, when that migraine attack hits. How are you going to be prepared? What tools do you have? How are you going to surf through that? I think also this is a time when we think so much about others, but it's really important to also think about yourself. And please be kind to yourself, be gentle, let go of some of those judgments and expectations for yourself, be patient, just as you would be to a dear friend, to a child, to someone that you would be kinder to. I think that we're often our own worst, harshest critics, and we expect so much from ourselves. And yet, if there were a friend or even someone you didn't know, but you knew they were going through that potential physical discomfort, pain, associated symptoms, we may judge them less harshly than we judge ourselves. So it's really important to not carry a self stigma as well, not feel guilty about what you can or cannot do because of migraine or limitations or changes or modifications you need to make. It's really important to go in with that mindset that you are navigating a potentially debilitating but episodic for many people chronic illness where attacks come and go. Now, there may be people who are listening also who have daily pain or even constant pain, and that's really hard to navigate with. And it's really important that you give yourself some grace and some kindness to yourself and change those expectations to what really matters to you and what can you do. Of course, I never want to miss a chance to remind everyone it's always a good time to do a migraine checkup. Think about, do you have a proper diagnosis? Are you seeing a healthcare professional to have your treatment needs met? And are you getting all the treatments that are right for you? We have a whole range of therapies that are effective that can be used independently or together. We've talked about some of the healthy lifestyle habits. We talked about those quite a bit in this hour. There's the behavioral therapies, the biofeedback, cognitive behavioral therapy, mindfulness therapy. There's the pharmacologic therapies, be they acute, taken at the time of an attack, or preventive, taken to avoid attacks. There's neuromodulation, and there are complementary and integrative therapies. It's always good to reassess how you are doing, how your health is, what treatments you're taking, if there's anything that you need to augment, add, or stop taking because it's not working anymore or not needed anymore. Always good to do that checkup. And while we talked about strategies here today, there might be times when you need more help, when you actually may benefit from talking to your doctor or a mental health professional, a psychologist, psychiatrist, therapist, counselor. And that's when it's times that you feel like anxiety, depression have become overwhelming. If you feel suicidal, it's important to reach out for help right away, including talking to your primary care professional right away, going to an emergency department, or reaching out for help right away. Um, there's also levels of distress that you may not feel that you need to talk to a mental health professional, but you would like support. And that might be time to talk to a religious or spiritual reader, an advocacy or support group. Here you're watching a podcast with Migraine Ireland and your social support networks. So it's good to have these supports all the time in place, and those can be really helpful. But think about if things ever feel that they are getting difficult to manage on your own, please reach out for help immediately. There are people like myself who are trained and want to help. This is what we do, this is what we're here for. So don't be shy to ask. Know that migraine is highly comorbid with depression and anxiety for a multitude of reasons. Um, they have genetic predispositions, they travel together, they share some of the same neurotransmitters, they're related to inflammation. There's a lot of reasons, and none of them have to do with you being weak or not handling things well enough. So, depression and anxiety travel with migraine, but they can all be treated. Migraine can be treated, depression can be treated, and anxiety can be treated. And when we successfully treat migraine, we tend to see improvements in the other two. And if we successfully treat depression and anxiety, the quality of life improves. So please think about if it is time to get additional help for yourself or loved one. So let's see. Any other thoughts or questions, comments, suggestions you want to make as we close up here? Please feel free to put them in the chat. But in some closing thoughts, not everyone will understand. And that's okay. Not everyone needs to understand, but it's really important that you feel confident and that you have the right to advocate for your own self needs, which you absolutely do. So think about as you come to the holidays, what aspects matter most to you? What brings you the most joy? What do you feel like right now at this point in your life, this time in the world, this time with your health, this time in your body? What matters to you? How do you want to celebrate or not? And kind of really keep that as your main focus and think about for you and your loved ones who are closest to you, if there's someone or some people that you really want to make sure have the holidays that you want, how can you make that happen without the same level of pressure and expectations, and knowing that if things change and they don't go the way that you might have hoped, that it's still okay. So that's what I want to close with. I really want to wish each of you and your loved ones a peaceful and fulfilling holiday season. And please be kind to yourself, as kind as you are to everybody else. If there's any more questions, please feel free to put them in the chat. And if not, I want to wish everyone a as healthy, as peaceful, as happy, as enjoyable, as fulfilling holiday season as possible. Thank you so much for joining me today.